Okay. Hi, everyone. My name is Ligaya Lange. I am the Director of Corporate Outreach for NAMI Greater Los Angeles County. I run the Stigma-Free Workplace Corporate Partnerships program, which we will review hopefully quickly at the end of the presentation. And I have with me three amazing panelists, Andrew Kantor, Blair Murav, and Niyc Pidgeon, who we are going to introduce further after the presentation I give. Then we're going to do a panel discussion, and then we'll hopefully end with a 10 to 15 minute Q&A. Okay, so first we're just going to go over, this is for everyone, by the way. I know it says managers and leaders and what you need to know, but it's for anybody that is in a workplace nowadays, because we are all dealing with life right now and anxiety and stress and depression, and 1 in 5 people has a mental health condition. So everyone can use this. But there are some key messages for anyone that leads or is a people manager. So we'll just get right into it. I think I'm pressing something. Okay. So yes, here we are. Workplace mental health, what managers and leaders need to know. You've already met me. Yes. Next, I can press it. Okay. Okay, so what we're going to go over in the presentation are just current stats and trends of where we're at today, especially in Los Angeles County, which we should all here be very interested in. Managers and colleagues, when and how to have a mental health conversation at work. So that's if it's someone that works for you, with you, if you suspect that there's a need, we're going to go over that. We also know that at these times, according to statistics, particularly remote workers, women in the workplace, and Gen Z are struggling with specific items. So we're going to go over that. And then we're going to talk about how you as a manager, leader, or just an employee can help support mental health and well-being in your workplace. Then we will review the Stigma-Free Workplace Initiative, just so you all know what it is. If any of you want to bring that to one of your companies or organizations. And then we're going to do our panel discussion, which I'm most excited about. So, and then Q&A to hear from all of you. So if you have any questions where you feel like it's a burning question, you need to ask it, please go ahead. But if you can hold till the end, that would be wonderful. And if there's any questions we don't get to, I will make sure there's a way for you to ask and for us to get back to you. Okay, so with that, I'm going to actually there we go. Okay, so here we are. This is where we're at right now. As I mentioned, 1 in 5 US adults experience mental illness annually. So that means 20% of the people in this room have some sort of mental illness. So it's very actually normal to have a mental health condition, whether it's anxiety, depression, or something more serious. You're going to be dealing with coworkers, managers, leaders, clients, partners, people who have a mental health condition. So according to, I always mispronounce this. Is it OSHA, Mary, or OSHA? OSHA. Okay, I always do. Nearly 1 in 3 US workers say their job makes them stressed always or often. 50% of US employees reported burnout in 2024, with Gen Z being especially vulnerable. We'll go over why later. As of 2025, this year, 36% of employees have difficulty accessing their mental health benefits, and only 1 in 3 uses them. So that's just more evidence that companies need to be doing a little bit more than just offering mental health insurance and maybe an EAP, which can be wonderful, but not if it's not being utilized. So we'll go over other things that can be done. More than half of employed Americans believe their employee is not doing enough to support their mental health. And then the cost to companies. So the bottom line, according to Gallup, low morale costs American businesses up to $550 billion annually due to lost productivity, absenteeism, illness, and other factors in their work environment. Mentally distressed workers are 3.5 times more likely to miss work, costing employers approximately $340 a day for a full-time employee and $170 a day for a part-time employee. And as work stress intensifies, 88% of employees say wellness support is as important as salary. So that is really significant, okay? That 9 out of 10 employees nearly are saying that wellness and well-being in the workplace is just as important as what they're being paid. Companies that invest in mental health wellness programs see a return on investment of $4 for every $1 spent. That's a 400% ROI. So the bottom line is you really can't lose out on bringing mental health awareness and programming to your employees. If you are a leader or a manager, or promoting it within your company, it can only help. Okay, I won't read every word of every slide, but I did want you guys to hear that. Okay. I just said that. I just said bottom line, you can't ignore mental health. Um, so most mental health concerns are not visible. We know this. So in a study by NAMI, stigma, which is the negative attitudes, beliefs, and stereotypes that society holds about individuals who experience mental health conditions. If anybody is willing to, please just raise your hand if you've ever been afraid to talk about mental health in your workplace. Okay, that's definitely more than half this room, right? So we have a mental health stigma that is still very healthy, especially, in a town like Los Angeles where we're so accepting and we're so inclusive and, we're a city that everyone is supposedly welcomed in. We deal with this all the time. I mean, prior to coming to NAMI, I worked for 2 big studios and Deloitte Consulting, and I never felt comfortable in any of those environments to bring it up. So I don't know if we'll talk about it later, but if it's the bigger the company, the more stigma you fear or whatever it is, but we need to be creating more mentally healthy environments. So for our employees. So more than 2/3 of employees say their managers influence their mental health, a figure that surpasses the impact of doctors and therapists. And what I didn't add in here is at times their own partners or spouses. Mm-hmm. So you managers in the audience or anybody that has influence over other coworkers know that the workplace is so important, whether it's remote or in person. Your manager and whoever oversees you has so much influence. And if you are a manager or a leader, please note that you have so much influence over your employees and you need to especially know how to deal with the topic of mental health and be open about it. So factors contributing to workplace stress, internal factors, psychological safety, which is really just feeling safe in your environment to be open and to talk about mental health and other issues without that stigma, without there being, I'm sorry, I'm like losing my words right now, but without there being any sort of, I don't want to say punishment, but any type of, issue with you saying something about, mental health or anything that you're feeling or wanting to say. So we want, open and welcoming environments for employees where they can truly thrive and communicate openly. That psychological safety is very important. We're going to talk about it later in the panel. Company culture, high stress, high pressure, low morale, untrained managers. Again, managers are getting promoted into positions and they may or may not be that great at leading people and really recognizing issues that may or may not be going on with their team and not addressing them, or maybe they are addressing them, but maybe there are better ways to address it, right? So we want to make sure that managers, especially, are the appropriate people and personalities to take on these positions of leadership. Uncertainty and change. We all know the job market, especially in Los Angeles right now, is very uncertain. And so change management in companies and knowing how to handle the mental health of your employees as maybe a merger is going on or layoffs. I just heard this morning, Amazon is laying off 14,000 people in the news. I mean, it's wild what's going on right now. And so this uncertainty and change is definitely a factor. External factors, political, societal unrest. I'm not going to get into that anymore. We all know. We are neutral here at NAMI. Financial challenges. Obviously, everybody worries about money, youth, mental health crisis. If you're a parent, you're definitely worried about your kids right now. Caregiving responsibilities, again, if you're a parent or you're taking care of, as I am, parents who are aging or anybody in your family that you need to take care of. You're not only responsible for your responsibilities at work, but you have everything that you need to deal with at home as well. So managing your own health and well-being, everybody says self-care, sleep, exercise, eat, as if it's that easy, right? So, but that is something that, is very important and you need to make time for. So this statistic on the bottom pertains only to Los Angeles. The mental health landscape in Los Angeles is shaped by a complex interplay of the COVID-19 pandemic, homelessness, crime and public safety issues, climate anxiety, and economic factors. These events highlight the need for increased access to culturally competent mental health services and resources, particularly for vulnerable populations and young people. So that pertains to just our wonderful city of Los Angeles. All right, let's have the conversation on how to talk about mental health. Let's have the conversation about having a conversation. So you're a manager or a leader in your workplace, or maybe you're just a concerned coworker and you're like, my coworker, my friend, or my employee seems like there may be something going on, but you don't know how to handle it. You don't know how to approach them. You definitely don't want to do anything where you may or may not get in trouble with HR. So this is the do's and don'ts according to NAMI National. So let's just go through them really quick. So the do's: let the person know you're there to listen. Lead with empathy and compassion. Be prepared with resources. Those resources can be the NAMI support groups or the EAP and mental health benefits that your company has. Other, organizations or nonprofits in the area that you know of. Like, you never want to go to somebody and say, I know you're struggling, period. You want to say, hey, I noticed something may be going on. And I just wanted to lend an ear. I just wanted to be here for you in case there's anything. I promise it's going to stay between us unless, something dangerous is going on. And you may want to tell your own story. Like when you're leading with empathy and compassion, it always helps to share your own struggles. So if you've had struggles with your work or mental health, it always helps to say, I've had anxiety since I was 18, which I have. So I can talk about that, but being open always helps. Tell the person they're definitely not alone. Remember that statistic, 1 in 5 people. Don't have to say that. It's not good to put statistics into your casual conversation, but just let them know that you're there for them and they're not alone in this. And that's why being prepared with resources is also important. And again, share your lived experience if you're comfortable. And this NAMI guide for managers, which we will be sending out the presentation and making it available online, you can just right click that and hyperlink and you'll go right to some of the things I just said. And the don't minimize or dismiss what they say. I doubt anybody here is going to do that, but don't be like, work is stressing you out. That's silly. Don't ever minimize or dismiss anything that they say. Just listen. Don't suggest a diagnoses, solutions, or treatment, especially just don't play doctor. You are not a doctor. You are, unless some of you are, excuse me. But if you're not a trained psychiatrist, somebody that does diagnose mental health disorders, don't even go there. Just be there to listen to them with empathy and respect for what they're going through, and be prepared with maybe your own experience to share with them as well. You really want to make this like an inclusive conversation that's comfortable for them. Don't go alone if you're concerned about safety. Obviously, if you think this person is dangerous, go with somebody else to have this conversation. And you may at that point want to notify your manager or any senior leadership that you feel comfortable with, because safety is the number one priority. Don't avoid bringing up suicide. Suicide is a very difficult topic. We're going to talk about it later in the panel. If you're afraid for some reason, somebody's been making comments like, gosh, I'd be better off not being here, any of those types of comments, it's very difficult to bring up suicide and to discuss that with somebody. But we'll talk about that a little bit more later. Suicide prevention is very possible. It's something that we need to do more of, and we cannot sweep the topic of suicide under the rug when it comes to the workplace, because there are certain industries where it's extremely prevalent. Number 1 is construction. Number 2 is automotive, sales, and maintenance. And I believe number 3 is medical and law. So you just want to be aware that, it's something you may have to broach with them. You just say, I'm not an expert, but here are some resources. I'm here for you if there's anything I can do. And then if there is a crisis, the 988 crisis line, they will de-escalate 90% of calls that they get. So it doesn't mean if you call 988, they're going on a 5150. Like, that's the opposite of what 988 actually wants to do. They will come out in person to assess the situation if necessary, but they actually will de-escalate 90% of the calls that they get. So again, do access that NAMI guide for managers if you want more information on how to have these conversations. So remote workers, let's get into the 3 demographics of workers that struggle the most right now. So I can't read that whole quote up there. About 20. Okay. Well, we have a lot of remote workers still. And people prefer remote work nowadays. I don't remember the exact statistic, but people really like being at home and having that flexibility. But there are issues with mental health issues that come along with that. So absence of face-to-face feedback, blurred work-life boundaries, lack of spontaneous social and community interactions, so isolation, increased anxiety, feelings of depression. constant use of technology notifications. I think we can all relate to this. We can all relate to this, right? Everyone's like, turn off your phone. Like, yeah, right. Like, who's going to actually? Okay, I have a 5-year-old. I have never turned off my phone. Okay, so cognitive overload and mental fatigue, especially remote workers, because in one of the studies I read, a lot of remote workers are in like the IT or, the technical end of things. And it's just very constant technology notifications, looking at their phone, looking at their email. We're all like that, really. And so it's important to keep in mind that this can lead to cognitive overload and mental fatigue for people. So the employer needs to work harder to foster open communication, promote work-life balance, and provide mental health resources. So again, if you're somebody who can just sympathize with this because you're a remote worker, then we're going to give you some tips on what you should do to, not feel this way. But also, if you're a leader or a manager and most of your employees work remotely, you need to be working a little harder to make those connections between your employees and make them feel like they're not alone in what they're doing. And they actually work for a company. They work for an organization. There is a company culture. So again, this year, this is the Gallup poll work location, 28% remote, 51% hybrid, 21% in person. And it's interesting because we've done several surveys now on some of our stigma-free partners. And I think almost 3/4 of employees across the board prefer things to be done remotely. Like they don't want to have to come in person. They just want to be able to view it on their computer. So it's interesting how much our society has shifted since the pandemic when we were all forced home. And now people prefer it, really. So you need to keep in mind, if you're a manager or a leader, the type of environment that you need to foster if most of your employees are working remotely. So women in the mental health place. This is the former Prime Minister of Scotland in the background. Her name is Jacinda Ardern. I don't want to say that wrong. But she said, giving absolutely everything of yourself to this job is the only way to do it. The country deserves nothing less. But in truth, that can only be done by anyone for so long. The weight of responsibility was immense. And it's only very recently, I think, that I've started to comprehend, let alone process the physical and mental impact of it on me. And she resigned. Mm-hmm. So, this is not something that is atypical. This happens a lot. Women feel overwhelmed in the workplace and in life because we juggle, and I'm not saying men do not juggle multiple roles, but I'm a mother. If any of you are mothers, taking care of your children, your marriage, your home, your family, your friends, your social network. I mean, we worry so much, and I don't want to bring up that statistic, but we definitely worry more than men. We do. And we're thinking in our sleep, basically. So it's really no surprise that women are struggling in the workplace right now because it's never been busier than it is now. So disproportionate caregiving and household responsibilities leads to chronic stress and burnout, limited advancement opportunity, which is still very much a reality in the workplace, unfortunately, and financial inequity increases emotional strain. Reproductive and hormonal factors. This is a big deal right now. Pregnancy, postpartum, and menopause and perimenopause. These are things that affect women only. And especially in Los Angeles, where, women have to, wait a little longer because they need to be able to afford a place to live. And everybody's just waiting a little bit longer. And so you get into your late 30s and your 40s and you want to start your family. And that's a big stress factor. And a lot of companies are responding to that by having, insurance benefits and things that meet those needs. But it's still a lot of companies that do not and don't even want to acknowledge it. Employer considerations: offer caregiver support, flexible work options, and inclusive policies, promote equitable pay and career development, and foster psychologically safe spaces for women to express challenges without stigma. So 42% of women state their job has negatively impacted their mental health over the past 6 months. Okay. And last but not least, mental health, Gen Z. Really struggling in the workplace, especially if the workplace is like a traditional corporate America type situation. This quote is really perfect. I can't perform to the best of my ability without taking care of myself. My well-being is the foundation for my productivity and success. This quote reflects Gen Z's view that mental health and work-life balance are not separate from performance, but are critical prerequisites for it. So this is just a completely okay. Do you want to ask questions? Yes.
Is this have to do with the common educational system?
Does this have to do with the K through 12?
Does it have is that involved? This
Hmm. Let me think about that and go back to it later because I want to make sure I answer you. And I'd actually have to think about that because that's not something that's been proven statistically or anything like that. But I see what you're saying.
If I may, Miss Ligaya, I
Yeah.
think you may be referring to the generation. I think after the Gen Y,
Yes.
X, Y, and then Z. So that may be the generation after the 2000s. Maybe from that gap. Yeah.
Do you want to know?
Oh, I'm doing a dissertation on it.
Oh,
But yeah,
Issa works with me, so he's part of NAMI. Thank you. Okay. We will come back to that. So their identity and values, they need to be aligned. So misalignment versus their desire for purpose-driven work. So Gen Z really wants to feel like they are working with an intention. They're doing what they love. They want to feel seen and heard, and they want to have the flexibility to also live their life and have that work-life balance that we all crave. So identity and values misalignment versus their desire for purpose-driven work can lead to disengagement and emotional exhaustion. Again, with the connectivity, digital overload, constant connectivity, more anxiety, sleep disruption, social comparison with social media is a huge thing with Gen Z. They're constantly on it during work, even if there are restrictions. I forget what the statistic is. I think it's like 60% are still doing it all day long. Not all day long, but multiple times during the day. Job insecurity, financial strain, rapid workplace change, high stress and burnout. We know that so many younger people are like living with their parents